Hello, everyone. So today I want to answer a question that was posted in the Facebook group. I'm not going to answer that question specifically, but more generally, the question was about medication side effects. So the medications used in atrial fibrillation do have potential side effects, as do all medications. In general, the medications used to slow the heart rate rather than to control the heart rhythm have side effects that are more of a nuisance than a danger. So they, for example, might make you feel tired or even a little short of breath, but they won't do you any actual damage. If your heart rate's already slow, particularly if it's slow when you're not in atrial fibrillation, then taking these medications regularly can make your heart rate go a little bit too slow for normal functioning when you're in normal rhythm, but it isn't going to make your heart stop. So that's those there. That's diltiazem, and then all the medications that end in alol. The only rate-slowing medicine that actually is quite dangerous is digoxin, and I hope there aren't many of you on digoxin or digitalis. It's a fairly old-fashioned medicine. And it has caused some very nasty arrhythmias, and since its only value is to slow down the heart rate in continuous atrial fibrillation, it is usually only used for people who are in hospital and who can't stand the blood pressure lowering effects of the other rate slowing medicines. Of the rhythm control medicines, they all have potential side effects. Some of them are actually a little more damaging. My recommendation is that you don't read through a great long list of potential side effects, which is provided in the box that you get your medicine in usually, or if not, you can certainly request it from the pharmacist. But if you have a symptom that is particularly one that is new shortly after you start taking these medications, what I recommend is that you give this list to a friend and ask them to look and see if the symptom that you're reporting is on that list. And if it is, then take that seriously, that it may be because of that medication. The only side effect that they all have in common is the potential to cause funny heart rhythms that are actually even sometimes worse than atrial fibrillation itself. This is obviously rare, otherwise they would never get through to market, but it does happen. It's the reason why some of these medications require you to start them in hospital, because those ones are more inclined to make you have the abnormal rhythm or show some sign that you're going to have it during the first few days. So that is for dofetilide and sotalol. These medicines are often started in hospital, although apart from in the United States, they can be started at home at small doses, gradually increasing. So of the rhythm control medicines, the one with the worst, longest list of potential adverse side effects is amiodarone. These side effects are known about largely because in the past, when there were no other treatments, such as ablation for atrial fibrillation or other abnormal rhythms as well, amiodarone was often used at very high doses, much higher than the doses that are usually used today. But because of those high doses, we do know that the amiodarone is capable of some fairly nasty and somewhat irreversible side effects. For most of the other drugs, if you stop them, then after a period of time, the side effects will go away. But some of the side effects of amiodarone, on particularly the lung and the liver, don't always go away, or at least not in a short amount of time. Warfarin is another medicine that most people are not on anymore now that there are newer anti-clotting medicines, but warfarin had some potential side effects. Some people had a nasty skin reaction to it. The biggest problem with warfarin was actually that it's difficult to keep it within the very narrow range of anti-blood clotting that you have to keep it within. And so people were quite frequently out of the range. So they were either over anticoagulated, where they were at risk of bleeding, particularly if they suffered any sort of trauma, or under anticoagulated where it wasn't protecting them from the clots like it was meant to be doing. So for that reason, most people are now on the newer anti-clotting medicines. These newer anti-clotting medicines are suspected of having a possible side effect that if you suddenly stop them for a brief period, you are more at risk of having a blood clot form. And this is possible. It was actually also a side effect noted of warfarin, that if you, when you stopped it, a brief period after you stopped it, there was even a higher incidence of clot formation. Having said that, there is a new strategy being tested where people who are only intermittently in atrial fibrillation take these newer anti-clotting medicines, starting at the onset of symptoms and stopping either hours or days after the end of the symptoms, depending on how long the symptoms went on. And these trials haven't particularly confirmed a high risk of more clots forming when you are starting and stopping the medication. So it may not be a particularly large effect that it has. Having said that, if you are thinking of stopping one, you should certainly discuss it with your doctor, and preferably if you're stopping it for relatively minor side effects, continue on the medication until your doctor can change you directly over from one anti-clotting medicine to another without a gap in between. And I think that pretty much covers the basics for side effects from the medication for atrial fibrillation. So I hope none of you are suffering from any of those. If you are, if you think you are, definitely discuss it with your doctor, because there are quite a few medications for atrial fibrillation. So if one isn't suiting you, there may be another one that would be just as good with a different side effect profile that might not affect you. Anyway, thank you, and we'll move on to the next question.